I'm going to shed light on an issue in AI and machine learning that you may not hear so much about now that the LLMs have taken the spotlight. And though ChatGPT and Google Gemini, or whatever it is that you may use, have plenty of interesting features to them and interesting utilities, something I want to shed light on is the utility of older techniques like computer vision and machine learning in diagnosing medical issues. Specifically, I want to talk about how conventional computer vision can be used to enhance medical imaging and how it can be used to hasten diagnoses and to improve patient experience. Now, the specific condition I want to shed light on today is endometriosis. Before we get to what endometriosis is, we have to define what the endometrium is. The endometrium is the lining inside of the uterus. And endometriosis occurs when cells like in the endometrium appear outside of the uterus, where they're not supposed to be, and form various painful masses, which cause several severe symptoms. Now, endometriosis is considered benign, which is that it is not considered cancerous. However, it does deeply affect the quality of life of many women and people with uteruses. Though endometriosis is considered a common condition, with an estimated 1 in 10 women, which is 10%, experiencing endometriosis or having and being diagnosed with endometriosis, the World Health Organization hypothesized that 60% of endometriosis cases go completely undiagnosed. Now, to further exacerbate that, the average diagnostic delay of endometriosis, as identified by the World Health Organization, is 4 to 11 years. This is a very significant amount of time to lose in your life with a mysterious condition whose particulars you were not aware and whose treatment you do not have access to. And that's why the diagnosis of endometriosis is so important to research. When it comes to women's health conditions like endometriosis, they all suffer from a shortage of funding and interest, and they're often under-researched, under-diagnosed, and underfunded, as we have mentioned. And because of this, it is difficult to improve the experiences of female patients when there is no material to work off of. Now, using computer vision, we can patch at least one of these issues, which is the method by which endometriosis is conventionally diagnosed. Endometriosis is conventionally diagnosed with a first-line imaging modality called transvaginal ultrasound imaging. Now, that is not the conventional ultrasound that you may be thinking of, which involves gel and a transducer moved over the gel and an image appearing on the screen. Transvaginal ultrasound imaging involves a transducer rod, which is inserted in the body so that the camera can see inside of the uterus through the cervix. And as you can imagine, it's very frequently uncomfortable and painful and intrusive, especially for younger girls. And because endometriosis can occur in any woman or girl who has reached menarche, which is as young as 9, it is important that we look at alternatives to improve patient experiences, because women and girls deserve better. They deserve comfort when they're in such a vulnerable position. Now, the alternative imaging modality is the conventional ultrasound imaging, which is the transabdominal ultrasound imaging. Now, that's done with the gel and the transducer rod, which is moved over the gel, and the image appearing on the screen. However, the issue is that the image is not as detailed as can be procured through the transvaginal ultrasound imaging technique. Because of this, often to observe masses and structures, the transvaginal imaging technique is preferred. An alternative to both of these techniques that is never used as an initial form of exploratory diagnosis is the MRI, which is magnetic resonance imaging. And I expect that you may have heard this term before and that you may be familiar with the radiation involved in MRIs. Because of this, it is less safe than the other two methods, and it is only chosen when the other two are not sufficient. When it comes to transabdominal ultrasound imaging, we are able to preserve patient dignity and comfort, and we are able to foster trust between the provider and the patient if the provider is perceived to take steps to preserve the patient's comfort. Now, the issue that we have to look into solving with computer vision is enhancing the details of the image produced by the transabdominal ultrasound image to be as clear or clearer than the transvaginal ultrasound image, so that it can be considered as a suitable alternative that can perform the same diagnostic functions and that can have the same level of effectiveness. Now, existing research shows that it is possible to enhance the image produced by transabdominal ultrasound images to be as accurate and detailed as an MRI scan. In order to implement this and to achieve it on a generalizable, God, I'm loving so many words today. It's a very serious issue, you'll have to bear with me. But in order to implement it in a general form, it is important that we focus research in that area, specifically when it comes to computer vision and machine learning, and that we not allow shiny new tools like LLMs to redirect our attention from the good that can be done with these existing technologies. Thank you so much. Thank you for listening, and I hope you learned a few things.